Hi, everyone. MPP Jeremy Roberts here, and I'm delighted to be joined today by Dr. Trevor Arnason, who's an Associate Medical Officer of Health for Ottawa Public Health and who specializes in vaccines. Dr. Arnason, thank you so much for being with us today.
Thanks for having me.
Oh, my pleasure. So we're going to be doing another installment of our COVID myths videos to try and address some of these common myths, common questions that are out there right now. And this week, we're going to be talking about vaccines. And so the first question that I wanted to ask you is a little bit about the speed of the vaccine development. So we hear time and time again from folks who say, it seems like these vaccines were developed so quickly. Are they really safe? I wonder if you could shed a bit of light on this particular issue.
Yeah, so there's no question the vaccines were developed very quickly, and in comparison to previous vaccines, which often take many years to develop. The reason for that, though, was clear. It was because the entire world was gripped by the same emergency, and there was no bigger goal for scientific research over the past year than getting a vaccine available to people. And now we're in the fortunate position where we have several. And the reason for that is because people use technology that's been in development for many years to right away, when they found out about the COVID-19 virus circulating around the world, to develop vaccines that could potentially be preventative based on what we know from decades of vaccine science. And they were able to put those through the trials immediately, and the trials. Because we saw, a lot of COVID over the end of 2020, we're able to evaluate the difference between people who got COVID and those who didn't, and whether they were vaccinated or not very quickly. And the governments worked to increase the speed of their administrative approval processes, as opposed to waiting for all of the data and information to come in. They started evaluating the data as the trials were ongoing. And that way, when the trial was complete, they could get the final approvals, authorizations for use in different countries very soon after the trial data was released. So these have gone through a shorter process in terms of coming to market, but they haven't skipped any steps. They've sped up all the steps along the way. And that was really because the scientific community noted right at the beginning of this pandemic that a vaccine was our best hope of getting through it, and started right away with all of the steps and working with government to make it quicker.
For sure. Well, and I think most of us are pretty happy with the speed that we were able to get it when we did, so that we can.
It really is incredible. It is a miracle. It's comparable to like the moon landing or something. Which it was very quick how quickly they went from John F. Kennedy saying going to the moon and then them landing on it. But it's amazing what the power of science is when you can have a one goal that everyone is working towards. And certainly, if you look at the authorizations and approvals, nothing was left out. That all of the same approval processes happened.
That's fantastic. Well, appreciate the information on that. The second question that I want to dive into is, we hear reports about some people getting sick after they get the vaccine. And so just wondered if you could shed a little bit of light on that, what folks should expect once they get the vaccine, and should they be worried if they get sick after getting one of the vaccines?
Yeah, so with all vaccines, the way they work is they're generating your body's immune response, which is so that if you encounter the natural virus, your body's going to fight it off. Some of the things that happen when we get a viral infection are like fever and feeling, muscle aches and chills, feeling unwell all over. These are actually our body's immune response to viruses. So they're not actually the virus itself that causes that as much as our body reacting. And when we get a vaccine, our body reacts in the same way. That's what we're hoping to do, to generate that response. So I wish I could say that, nobody ever gets these symptoms after they're vaccinated, but it's simply not true. We definitely see people get symptoms. It's expected. Fortunately, the symptoms are not usually severe. Like we see mild fever, certainly see pain around the injection site. Sometimes we see rashes, and often these symptoms can be worse after the second dose of vaccine because the immune response has already been primed by that first dose. The second dose makes it much more of a pronounced response. But certainly these aren't things to worry about. In terms of serious side effects, they're extremely rare. The one that we concern ourselves most with at Public Health, and the one we monitor for very carefully, is an allergic reaction, a severe allergic reaction like anaphylaxis. We see that in about 10 out of a million doses of the coronavirus vaccine. So it's a very rare event. It does happen, and we're prepared to treat it on site at all of our clinics with epinephrine, which is the treatment for severe allergic reactions, and we monitor everyone for severe allergic reactions for 15 minutes. And no one, there's been no reports of anyone dying from a severe allergic reaction to the COVID vaccine at this point.
No, that's fantastic information. And kind of building on that, another question that we hear quite often is from folks who say, is there a live virus in the vaccine? Is there a chance that you could actually catch COVID-19 from taking one of the vaccines?
Yeah, so these are inactivated vaccines, all of the ones we have for COVID in Canada. With an inactivated vaccine, you cannot get the illness from the vaccine. There are some vaccines out there that have what's called an attenuated or weakened version of the live virus. Those are live virus vaccines. That is not the case for any of the COVID vaccines or the ones in development. So, what I like to say is, with an inactivated vaccine, you cannot get sick with the virus, and it's the same as like you can't grow a chicken from scrambled eggs you've had for breakfast. There's so much that goes on in the processing of the vaccine to make it so that it can be injected in a way that your body is going to notice the parts of the virus that the immune system recognizes. So it's all about just giving your body the picture of the virus, recognizing the virus, so that if it naturally enters your body at a later point, your immune system says, "Oh, I know what that is. That's the enemy. I'm going to attack right away." And the best way to do that is actually to scramble up and isolate the parts that the body recognizes the best, which are actually this called spike proteins, which are on the outside of the virus. So they just take they will either take the spike proteins, or with these new mRNA vaccines, it sends a message. It's called a messenger RNA. It sends a message to your cells to actually produce just the outside of the virus, just the spike protein, so that your body can recognize it, which is really an amazing thing.
That's fascinating. And the last question that I've got for you, Dr. Arnason, is kind of about the post-vaccine. So once you've actually gotten your vaccine, we hear from a lot of folks who say, are you still able to pass COVID along to somebody else once you've been vaccinated? Is there any information that you can share with us at this point about that question?
It's a great question. When the vaccines first came out, we actually had very little to no information on this point. And it's a big one for public health officials, because we want to know, if the people getting vaccinated are protecting themselves, but are they also protecting the people around them? With a lot of vaccines, our goal is to get to such a high level of vaccination in the community that we have something called herd immunity, where everyone, even if they're not vaccinated, is protected because so many people in the community are vaccinated. With this vaccine, we didn't have a lot of information from the trials, because they wanted to focus on how does the vaccine protect the person who's vaccinated. Now that the vaccines have been approved and used in many countries successfully, and they're safe, we're able to start studying how they impact outbreaks and how they impact transmission of the virus. And it turns out that they probably do knock down transmission quite a bit. So it probably reduces your ability to infect others. However, nothing with vaccines is 100%. There's certainly, few things in life are. There is still the possibility that you can get a mild infection with coronavirus and pass it on to a person who's unprotected, who's not vaccinated, even though you are vaccinated. I think it's abundantly clear that the vaccines protect an individual against death and hospitalization. And now it's becoming clear that they protect against people getting milder infections as well and passing it on to other people as a mild infection. The only thing is that it may vary depending on which type of vaccine and the circumstances in the person who gets vaccinated. So these are all things that we still don't have very clear picture on and will develop over time. And I think, in Ontario right now, we're trying to get as many people vaccinated with a first dose. And as such, we're going to have a lot of people who aren't fully vaccinated, and it's going to be really important to do all the same measures that we've been doing until we can get most people the 2 doses of vaccine, because most of these depend on 2 doses. And those measures are, the hand washing and the wearing a mask and those types of things. They're still really important for a while, but they are eventually, it looks like, going to become unnecessary.
Yeah, no, we want to be extra cautious to make sure that you don't risk, even once you've had that vaccine, passing it along to someone who isn't vaccinated yet. And that's why we still need to be cautious going forward.
It's been a long haul, but the vaccines have given us the light at the end of the tunnel. We just don't want to ease up before we reach that light, which it's looking more and more like summer, and I think the critical time right now is not to ease up. So that's what I think.
Well, Dr. Arnason, thank you so much for shedding light on all of these questions. I know my constituents will really appreciate it. And again, thank you to all of the tremendous work that you and the entire team at Ottawa Public Health are doing throughout this pandemic, and of course through the vaccine rollout. It is very much appreciated.
Thanks a lot. Have a good day.
Great. Cheers.